and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. He's from the University of Madras. His PhD in the role of Ayurvedic.
A very good evening to all of you in this live interactive session of ours where we generally try to discuss quality Ayurveda with you. It was a bit busy curriculum in the past few weeks, and that is why I missed on some of my live sessions with you guys. And today also in the morning I could see a number of questions which were coming from your end. But since I was not available, I decided that yes, in the evening today, definitely I will be joining live with you guys so that I can discuss some important Ayurvedic guidelines with you. And at the same time, I wanted to ensure that we are not missing out on your valuable questions. So once again, our major topic of choice over here will be autism. And when we talk about autism, I always tell you that autism is a temporary phase in the life of a child when it is treated timely. And the timely word is really very important for everyone to understand over here. Is in the past few days, I got a chance to interact with some of my existing patients, and I could see over there, I saw over there that they are taking the medications regularly, consistently, but unluckily, they were not very regular with the ABA sessions. And in some of them, some of the cases, when I spoke to them, they even told me that yes, we are going for sessions and we are going for sessions at a nearby center to our place. But when I asked them about the videos of those sessions, I was updated that the centers are not allowing them to record those sessions. Now, that was something which was again very astonishing for me, because as a parent it becomes very important for you that if you are sending your child to anyone for any session, it becomes very important for you as a parent to be monitoring that session. And it becomes very important for us to be knowing that those sessions are not command based sessions, and those sessions are in the way in which we generally advise the parents to be going for sessions. So that is why I would like to update you as parents over here that if you are believing on us for the autism free journey of your child, it becomes very important that if you are going for a psychotherapy session which is not there with us, please do not forget to regularly and consistently share the videos of your child undergoing that session. Because if we do not get the videos, and if the techniques which are being used for your child are more occupational therapy based, if they are more of OT based techniques, then that can be causing a real problem. Because it is the command based learning which we need to be avoiding in all such cases, in all such children. If we really want that a child is to come out of autism, then the most important thing for us to realize over here is that the training cannot be command based in such cases. When I say command based training, in most of the therapy centers where you send your children, the biggest problem that is that it's a group of children in which the center is working. And when the center is working for a particular group of children, they are trying to give command based learning, they're trying to impart command based learning to those children. And while those commands can give us some initial benefits, in the long run, if we really want a child to be completely out of autism, now that is something which that command based learning cannot help us out with. Because when we talk about autism, autism is a temporary phase in the life of your child. And when we say it is a temporary phase in the life of a child, what I mean to say over there is that in autism, a child, in most of the cases where the child has been blessed with a normal brain by God the Almighty, the child goes in a shell. Just like in adults, someone may be going in a depression. Now, to bring someone out of depression, it's not just the medicines which can play the role. The family is guided, the family is always told that, see, this is the way in which you need to be interacting with someone who is currently suffering from depression or is in a depressive phase. Similarly, in a child who is suffering from autism, it becomes even more important because it is very tough to counsel a small child, a young child of 3 years, 4 years, 5 years, 6 years. You cannot expect the child to be listening to you in the way in which you want. You cannot expect the child to be following what you want. It is more about you going to the level of the child and then entering their world in the way in which they want and then putting those thoughts in their mind. Now, that is really very important when we talk about bringing a child out of autism, and that is why I always say that the role of the specific ABA curriculum, which has been designed by us, is so very important. And always remember, if you are going for any kind of therapy at any center for autism, always try to discuss with them the success stories which they have, the level of improvement which they are expecting in your child. Because if we really want a child to be coming out of autism, it can only be done with experts. Even if we are to learn driving, we go for experienced drivers. If we are to go for a coaching class, we always preferred trained tutors and experts. Then for a child's life, where we know that the entire life of our child depends upon how the child is being imparted training, how the child is being dealt, it becomes so very important that we just not leave our children to any odd therapy center. It becomes very important that the therapies are done in a proper curriculum with proper recordings, and they are all non-command based therapies. Uh, I'll be going to the questions now. नमस्कार सर, हाइपर एक्टिविटी बार बार रिवर्स हो रहा है, कभी शांत बिहेवियर शो कर रहा है, फिर कभी बहुत हाइपर हो जाता है, डरता भी बहुत है सर, कब बच्चा पूरा नॉर्मल लगेगा और कितना टाइम लगेगा? आईडी है स्वागिता की जी। मैं स्वागिता जी थोड़ी सी डिटेल्स आपसे चाहूँगा इस रिगार्ड्स में, मुझे प्लीज़ थोड़ा सा डिटेल्स मेंशन करिए और क्या इलाज चल रहा है, कब से इलाज चल रहा है, थोड़ा डिटेल्स आपकी तरफ से मेरे पास आता है। मैं बाकी जो मेरे पास आया है मैं ज़रूर बताना चाहूँगा। मेरे पास आपके बारे में बताया है गया है कि सुब्रादित्य मोहंती जो है वो नाम है और 6 years 9 month एज है, बिहार से आप हैं। और इसके साथ साथ मुझे बताया गया है कि ब्रेनोआर, कुकुरबिटा ऑयल, जटामांसी ऑयल और मुक्ता बिष्टी, ये वो चीज़ें हैं जो चलाई जा रही हैं। इसके साथ शिरो-पिचू आपने थोड़ा-सा वेदर चेंज होने के कारण बंद कर दिया है। मैं चाहूँगा शिरो-पिचू दोपहर के टाइम पे कर लीजिए, जब सूरज निकला हुआ तब कर लीजिए, लेकिन पूरी तरह से आप बंद मत करिए। हाँ, जब कभी भी आपको लगता है कि कोल्ड चल रहा है, उन पर्टिकुलर डेज़ में आप डेफ़िनेटली अवॉइड कर सकते हैं। यहाँ मेरे पास जो डिटेल आई है, वो आई है कि 37 एबीए सेशंस हुए हैं राहुल के साथ, और थोड़ा-सा गैप पड़ गया था बीच में सेशंस का, शायद मैडम की प्रेगनेंसी के कारण। तो मैं सिर्फ़ आपको यही कहना चाहूँगा कि हमें किसी भी कीमत पे सेशंस मिस नहीं करने हैं। देखिए, खास तौर पे एक ऐसा बच्चा जो 7 महीने का होने वाला है, वहाँ अगर हम इलाज कर रहे हैं, ये और ज़रूरी हो जाता है कि किसी भी कीमत पर एक भी सेशन को हम मिस नहीं करें। सेशंस बहुत ज़रूरी हैं हाइपर एक्टिविटी को काबू में रखने के लिए, अभी के लिए। एक बार जब हम उस स्टेज पे आ जाएंगे कि हाइपर एक्टिविटी 90% तक रिड्यूस हो चुकी है, फिर डेफिनेटली उस स्टेज पे जाकर के हमें ज़रूरत नहीं रहेगी सेशंस की, और वहाँ से कभी भी आप ये नहीं देखेंगे कि बैक गियर लगे। ये जब कभी भी हम ऐसा देखते हैं कि किसी भी प्रकार का हमें रिग्रेशन कभी भी देखने को मिल रहा है, ये इनिशियल फेजेस में ही जब हम ऐसा करेंगे कि हम इनिशियल फेजेस में किसी कारण से चाह कर के भी जो है वो सेशंस उतना कंसिस्टेंटली नहीं करवा पा रहे जितना कि चाहिए हैं, वहाँ जो है केवल चैलेंज हमें देखने को मिल सकता है। तो मेरी यही रिक्वेस्ट रहेगी, किसी भी कीमत पे जो है वो आप सेशंस को हरगिज भी मिस नहीं करें। सो हम आगे चलते हैं और नेक्स्ट क्वेश्चन जो मैं देख पा रहा हूँ, मेडिसिन की जहाँ तक आपने बात की है कि मेडिसिन की अगर मैं बात करूं तो अभी के लिए जब आपको कभी भी लगता है कि हाइपर एक्टिविटी ज़्यादा है, तब आप जटामांसी ऑयल की डोजेज को थोड़ा सा बढ़ा सकते हैं। केवल तब जब आपको लगे कि हाइपर एक्टिविटी कुछ बढ़ी हुई है, उन दिनों में केवल आप जटामांसी की डोजेज को थोड़ा सा बढ़ा सकते हैं। अदरवाइज जैसे ही दोबारा आप देखते हैं कि नहीं, वो सिचुएशन लौट आई है, जो बच्चा पहले था, तो जटामांसी को फिर से आपने रिड्यूस करके जो डोज हमने बता रखी है उसी डोज पर आपने दोबारा से ले आना है। नेक्स्ट क्वेश्चन जो मैं देख पा रहा हूँ वो है नूर पाशा जी का। सर मेरा बेटा 9 इयर्स का है और आपने लिखा है कि अब करने लगे हैं हैंड शेक करना, लिखना पढ़ना। नूर जी, आपने साथ में अपने पेशेंट कोड भी दिया है मुझे, और मैं आगे चाहूँगा कि एक बार कुछ वीडियोस आप अपने बच्चे की ज़रूर शेयर करिए हमारी टीम के साथ। देखिए, 9 साल की एज में अगर हम एक बच्चे को ऑटिज्म से बाहर निकालना चाहते हैं, डेफिनेटली ये अधिक चैलेंजिंग है एक छोटे बच्चे से, लेकिन 12 साढ़े 12 साल से पहले तो बच्चे, अगर पेरेंट्स मेहनत कर लें, तो ऑटिज्म से ज़रूर बाहर आ सकते हैं। सो मेरी रिक्वेस्ट रहेगी, एक बार वीडियोस आप शेयर करें। जब वीडियोस मेरी टीम देख पाएगी तो उन वीडियोस के आधार पर वो आपको पूरी सही जानकारी दे पाएगी कि हम जो है वो इस रिगार्ड्स में क्या कर पाएंगे। और हम आगे चलते हैं, और आगे बढ़ते हुए मैं अगली चीज़ जो आपके साथ डिस्कस करना चाहूँगा वो है कुछ हाइपर एक्टिविटी रिड्यूसिंग एलोपैथिक मेडिकेशंस की। बहुत बार जब बच्चे हमारे पास आते हैं तो एरिप्राजोल या रेस्पेरिडोन, सीजोडोन, ऐसी दवाइयाँ बच्चे अक्सर ले रहे होते हैं। मेरी आपसे एज अ पेरेंट रिक्वेस्ट है कि जब तक बहुत ज़रूरी ना हो, बहुत अधिक एग्रेसिव आपका बच्चा हो गया है, कंट्रोल करना बहुत मुश्किल हो रहा है, तो समझ में आती है कि आपने वो दे दिया, वरना 90% केसेस में सही आयुर्वेद और सही साइकोथेरेपी से ही हम हाइपर एक्टिविटी को बड़ी इजीली कंट्रोल कर सकते हैं। तो ऐसा कोई भी दवा जो बच्चे से जबरदस्ती उसे सिडेट करके हाइपर एक्टिविटी रिड्यूस कर रहा है, वो हमें ऑटिज्म में अवॉइड करनी है, क्योंकि अल्टीमेटली ऑटिज्म में हम चाहते तो यही है कि हमारा बच्चा अच्छे से बोले, हमारा बच्चा बोलने के साथ साथ सोशलाइज करे, आई कांटेक्ट करे, उसकी कॉग्निशन बढ़े। हमारा मकसद सिर्फ और सिर्फ एक हाइपर एक्टिविटी कंट्रोल करना नहीं है। अगर केवल हाइपर एक्टिविटी कंट्रोल करना ही हमारा मकसद होता तो डेफिनेटली केवल वो तो दवाइयाँ जो आप दे देते हैं ऐसे एलोपैथी में, उससे काम चल सकता था। हमारा मकसद है एक ऐसा बच्चा जिस बच्चे को कि ऑटिज्म नाम के इस अवस्था से बाहर निकाला जा सके। क्योंकि जब कभी भी एज अ पेरेंट आप हमें रीच आउट करते हैं तो हमारा मकसद कभी भी ये नहीं रहता है कि हमें केवल कुछ साइंस एंड सिम्टम्स पे काम करने हैं। ऑटिज्म का इलाज मतलब एक बच्चा जिसे कुदरत ने बिल्कुल नॉर्मल जिंदगी जीने की काबिलियत दे करके भेजा है, उस बच्चे को हर हाल में एक बिल्कुल नॉर्मल जिंदगी तक लेकर के आना। जब तक हम नॉर्मल जिंदगी तक नहीं लेके आ पाते हैं, तब तक वो इलाज जो है वो एक अधूरा इलाज है। सो यही कारण है कि हमेशा मेरी पेरेंट्स से रिक्वेस्ट रहती है, अगर आप हमें अप्रोच करते हैं, नंबर आपके सामने है स्क्रीन पर। हमारी तरफ से जो वीडियो एनालिसिस होते हैं आपके बच्चों के, वो वीडियो एनालिसिस इंटायरली फ्री ऑफ कॉस्ट रहते हैं। तो रिक्वेस्ट आपसे यही है, जब कभी भी आपके लिए पॉसिबल बनता है, आप ज़रूर जो है वो वीडियोस शेयर करें ताकि वो वीडियोस एनालिसिस हो सके। हम श्रुति जी, आपका क्वेश्चन ले रहा हूँ। सर, वी हैव सीन इम्प्रूवमेंट इन माई डॉटर्स बिहेवियर, स्टार्टेड द मेडिसिन इन मे, बट स्टिल when we take her to external environment, the behavior is seen more of excitement towards the surrounding. Shruti ji, that is very much understandable. See, the socialization of a child and a child being absolutely normal in the social environment is the last thing to improve. In the beginning part, the child will start showing you a normal behavior at home. Then gradually, once you see that the behavior is normalized at home, then our AB expert will start working for your child in the external environment also. But to begin with, we will have to confine ourselves to the internal environment. Yes, keep on exposing her to the external one, but don't be demotivated when you see some non-satisfying behavior in the external environment. It will take a longer time for a child to feel comfortable in the external environment. You can yourself feel that even when we were children, and even if a child is normal, a child is not always very confident at a new place. And at times, if a child likes a place, even if we used to like a park or something, if you remember your childhood, think about it and you will feel that yes, it was common for us also to be excited over there. So don't at all worry about this fact that when she goes to a new environment, she starts showing some behavior patterns which are not enjoyed by you. The most important is that it is now not a regular thing for your child at your own home. Soon you will see that even in the external environment, she will be showing absolutely normal behavior. And moving further, it was a small live session today. It was not a longer and a committed live session. The only thing is that I promise always to my parents, patients that yes, Wednesday will not be something which I am going to miss. So, as a matter of commitment, it was important for me to join you guys today because I couldn't join you up today in the morning. So, it was a brief session. I will be taking a break from you, and I hope I was able to answer your questions which you had in your mind. And wherever you feel that you have any question which was unanswered by me, the helpline number is there on your screen. You can always share your questions on the helpline numbers, and whenever I go next live, I'll be willing to join with you all. Have a great day. Goodbye as of now. Take care.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
Hello.
आ जाएगा वो.
कलर करो. वेरी गुड पार्ट. कलर करो. नो, इस हैंड से करो. वेरी गुड. इसके अंदर रख दो. वेरी गुड. पापा ना हैंड दीदी का हैंड करो. वेरी गुड. हाउ? वेरी गुड.
Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. The sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Rogam.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Vitika, age, 20 years old, disease, autism. Chief complaints, hyperactivity, behavioral issues, shouting and screaming, irritation.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on 23rd January 2023 at 3 o'clock p.m. and felt the scope of treatment to work for the child. Before the treatment, the chief complaints were regarding hyperactivity, shouting and behavioral issues. She screamed abruptly and showed irritative behavior frequently. With the ongoing treatment, significant improvement was there in her condition. Hyperactivity was reduced a lot. She also became more calm and also stopped shouting. Along with that, irritative behavior also showed improvement. She also got involved in co-curricular activities like sketching and painting, which improved her performance. She also showed a lot of growth in terms of expressing herself. She started singing and other activities.
I am Ranjit Sen. My daughter's name is Vitika Sen. She is an autistic patient. Approximately a year ago, I found Dr. Namin Sharma through a Google search, saw his professional website, and after that we promptly contacted him. Since the beginning of January 2023, we have consistently been taking the prescribed medicine. Under the supervision of Dr. Namindu Sharma, in 9 months, we have seen a lot of improvement from this medicine. In the beginning, my child used to scream. She would suddenly scream all the time. She was irritable all the time. She was hyperactive. She was extremely hyperactive. After taking the medicine, her irritability and aggression have reduced a lot. Along with the medicine, Panchakarma was also given and psychotherapy was also ongoing. So, with this combination of psychotherapy, Panchakarma and medicine, overall my child is much better now. She's much better than before. In Ayurveda, we feel that Dr. Narang Sharma is a very good doctor, especially for autism. Thank you.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Vivan, age, 4.5 years old, disease, autism. Chief complaints, speech delay, less understanding ability, inexpressive, sensory issues, lack of focus.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on 27 November 2022 at 11 o'clock am and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class, and also understand things in a better way.
Hi, my name is Priya, and my son is about to turn 5 years old, and it's been over a year since I've been taking medicine from Navdeep sir. And I have changed, I have seen immense change in my son. Like when we first came here, he used to say just one word at a time. And ever since we started the medicine, and along with the medicine, he's also been undergoing Shirodhara for more than a year now. And with the continued use of the medicines and everything, there has been a drastic change. Now he can express almost everything, about 99% of his things easily, and that too, he has started making full sentences also. Even academically in class, he is doing superbly awesome. He has scored 80% in his last term, and when he was in nursery, he had just scored 55%, not even 50%. And now, just in term A of junior KG, he has scored 88% marks. Now he has started writing also. Earlier, he used to write by just holding on to things. Even when holding a pencil, his grip wasn't proper. But now he has started writing as well. Plus, the main difference I have noticed from the medicine is the improvement in his sense, the development in his awareness that I wanted to see. Earlier, it didn't matter to him at all if someone was coming or going in the house. He was just operating on commands. Like he has started following my commands. But he wasn't doing anything on his own. But ever since he started taking the medicine, after 3 months, I saw more changes. Over the course of 3 months, the changes came gradually, little by little. Now within a year, there has been a drastic change. Looking at him now, you can't even tell that he had mild autism. Yes, he only had mild autism. But now he has even moved out of the mild autism spectrum. Now only a few minor symptoms remain. And we are still in touch with Navdeep sir. We are still taking the medicines. Whatever guidance he gives, whether it's about diet or his prescribed instruments, we are following that religiously, and I mean it. Along with that, we also teach him healing music so that the child heals internally as well. We are giving the medicines, so I am quite happy with the medicines and the facilities. The doctors are always available, and it's been more than a year now. I get a call from here at least once a week to check whether things are going right. They ask about Vivan, how he is doing. So they are in consistent and supportive touch. The entire dedicated team has been in close communication with me for well over a year now, providing continuous assistance and updates. The essential medicines are consistently arriving here at my location precisely on time, without any delays whatsoever. We reliably receive the delivery of these crucial medications directly at our home, ensuring utmost convenience and accessibility.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
A patient name, Moksh, patient age, 6 years old, disease, autism. A chief complaints, hyperactivity, aggressive behavior, speech delay, deficit eye contact, lack of attention. A history of patient. Moksh's parents consulted Dr. Navdeep Sharma for his autism treatment. They discussed about the chief complaints. They started the treatment after being convinced for the same. Interacting with Moksh was challenging as he had difficulty understanding and rarely engaged with those around him. Moksh struggled with speech delay and often seemed lost in his own world. His hyperactivity and irritative behavior made it hard for him to connect with others. After treatment from ND Care by Dr. Navdeep Sharma, Moksh has started using words to express himself, and his speech has improved significantly. Moksh is now much calmer and more focused. The hyperactivity that once overwhelmed him has reduced, and he's more at ease. We're seeing a new side of him. He's interacting more, engaging with those around him, and forming meaningful connections. His understanding has grown remarkably. He responds better, and everyday moments now feel filled with progress and joy.
Hello, my name is Pooja.